My name is Crystal Smith, Vice President of Behavioral Health at Pillars Community Health. In recognition of National Recovery Month, whose 2020 theme is Join the Voices of Recovery, Celebrating Connections, I'd like to take a few moments to answer some frequently asked questions submitted by members of our community. The first is a very common question, and that is, what is the difference between CBD and marijuana? Marijuana is composed of two compounds, CBD and THC. THC is the main psychoactive compound in cannabis that produces the high sensation. CBD is the component responsible for helping many of those with medical needs such as anxiety, chronic pain, seizures, and other conditions. CBD can be consumed in many forms such as oils and gummies, etc. So the main difference between marijuana and CBD is the THC compound. The second question is also very common and very relevant. How do you prevent your children from going down the wrong path? Is there a gateway drug? Marijuana is often thought to be a gateway drug, but this does not mean that those who use marijuana will later begin using other substances. Although one study found that adults who use marijuana were more likely to develop an alcohol disorder within 3 years, the majority of people who use marijuana do not go on to use another harder substance. In general, it's important to be a positive role model for our children and know that actions speak louder than words. We should model the same behaviors we want to see our kiddos do. And it's important to continue to create and cultivate an open line of communication. Teach your children how to say no when they're offered substances, and let them know they can talk to you without fear of judgment. If your child trusts you and that they know they can talk to you about substances in their life, they will be more comfortable coming to you. The third question, how can you help someone who is resistant to treatment? Or what if the person who needs help doesn't think they have a problem or doesn't want help? Well, we can't force anyone to enter into treatment for any concern, including a substance use disorder, and it can be difficult also to watch a loved one struggle. We can make several attempts to point out the behaviors that we notice in a non-judgmental and supportive and caring way, although sometimes this isn't enough to encourage somebody to seek treatment. For someone who's aware of their habits but doesn't see a problem, we can help them realize the negative effects of using substances by pointing out the consequences and impact it has on their day-to-day life. How does it make them feel? How is it negatively affecting their relationships and their work life? Also important always to come from a place of caring and help the person feel supported so that they don't feel attacked and become more defensive and resistant. Keep that line of communication open and continue to talk to your loved one about their substance use. The fourth is similar. What is the best way for a friend or relative to encourage someone to seek treatment and then support that person? Very important to support them during their recovery. Great question. So similar to the previous question and answer, it's important to be non-judgmental, listen and acknowledge the person's feelings around their substance use, bring attention to the specific behaviors that you see that are unhealthy. And as a person of support, it's important to know that relapses are not uncommon. Substance use recovery is not a linear process. Ups and downs are to be expected. So focus on the positive changes that your loved one is taking and support them through that process. Understand that change will not happen overnight. It will take multiple conversations before someone can consider treatment. It also takes multiple attempts and efforts on their part to be successful in their recovery. Please know that the resources used to formulate these responses can be found attached to this video or on our website. Please join us if you need support or have more questions at www.pillarscommunityhealth.org. Thank you.